Mr. Jones. My name is Sam. I'm going to be your nurse today. We're going to do a little bit of trach care. Should take about 10 minutes or so. I'm going to make sure I have my obturator, my pump, all my oxygen equipment. It's all right here. Okay, I'm going to listen to your lungs and see if we need to suction your trach before we clean and change everything. And I would be listening underneath the gown on the skin. Okay, I hear some crackles in there, so we're going to suction out some of that extra fluid. Before we suction, I'm going to give you a little bit of extra oxygen. You turn this up, 100% oxygen, make sure your bag inflates. Okay, we're going to put this oxygen on, and I'll have you take 5 or 6 deep breaths for me. And you'll do that for a minimum of 30 seconds. Okay, good. Turn that off and leave that there just in case we need it. Okay, we're going to go ahead and suction. Usually the patient will cough. We'll go ahead and suction as you pull it out. Make sure the black dot's above the green so there's no cannula left in the airway. Turn that back. Okay, I'm going to remove your dressing. It should be on there. You'll note the coca of any drainage that's on there. And toss that. Take your gloves off. Go do hand hygiene. Come back. Okay, Mr. Jones, we're going to go ahead and clean around your trach and put a new dressing on there. Are you doing okay? Any shortness of breath or anything? Okay, good. So I got my trach kit and some sterile saline. So you open up your kit. Pour about 1 inch of saline in the chamber. And do not recap. Over there. Got my sterile gloves. Okay, and you'll put a sterile drape over the patient's chest. And then you'll want to put the wire brush and a couple 4x4s into the saline. And you'll keep a 4x4 and the clean dressing dry. And you'll have a couple cotton swabs there too in case you need them. Okay. I'm going to have you take about 5 or 6 deep breaths for me again before we take the cannula out. Okay, I'm going to take out the cannula now. Drop that in the saline. You'll quickly get your wire brush, clean in there real good. Clean around the outside. Hold the inner aspect with your sterile hand and rinse with the saline. That back in. And I would not touch the inner aspect of the cannula with my non-dominant hand since it's not sterile. Okay. rehook them up to the oxygen. And you'll take your 4x4s. Clean around the outside of the stoma about 2 to 4 inches in every direction. Go in a circular motion from the inside to the outside and throw that away. You'll take your dry 4x4 and pat dry around the area. And then if you need to clean more with the cotton swabs, you can. Clean the faceplate. And then we will go ahead and place this new dressing. And if you need to, you can use the cotton swabs to help push it underneath the trach ties. You'll want to assess the trach ties, make sure they're clean. If they need to be changed, grab someone to assist. And then also be sure there's 1 or 2 finger spaces underneath the trach tie so it's not too tight. Okay, how are you feeling, Mr. Jones? Any shortness of breath, chest pain? No? Okay, good. Well, we're all done with that. And then you would document the patient's respiratory status before, during, and after the procedure. Document the type and size of the trach care that you did, how the patient tolerated it, and if there's family that will be doing any trach care at home, you'll want to educate them and document that as well. All right, Mr. Smith, I'm going to go. Do you need anything else while I'm in here? All right, great. Thank you.